Hello and welcome to another edition of County Conversations presented to you by Richmond Observer. I am Matt Harrelson, your host for the day, and joining us for the second County Conversations is Dr. Tommy Jarrel from the Richmond County Health Department. We appreciate him joining us, but before we get started, we of course want to give a shout out to all of our sponsors for County Conversations. That includes One Stop Vape Shop, McNair Auto, Rockingham Paint and Glass, The Berry Patch, Sunbelt Distribution, Kenny Melvin and Farm Bureau, Computer Zone, Remax Realty, and Iron Horse Auction Company. So we of course appreciate those sponsors for the County Conversations. Now we are here inside of the Richmond Observer studio. So let's get started. Once again, Dr. Jarrel, we really appreciate you joining us.
Well, thank you for the invite. It's a pleasure to be here.
Absolutely. So obviously right now, everybody in the world is talking about COVID-19, the pandemic, and we're going to talk about that, of course, here in just a moment. But what we like to do with the County Conversations is first off, I want to talk to the folks just a little bit about yourself. So first, tell us about a little bit about your education, how you got into this line of work, and why you decided to do that.
Certainly. I'm a lifelong resident of Richmond County, grew up here in Rockingham. My parents grew up here in Rockingham as well. I'm the son of the late Randy and Carol Jarrel of Rockingham. Graduate of Richmond Senior High School, went to Appalachian State University and received my undergraduate in healthcare management, and later went to Central Michigan University to get my graduate degree in public health, and then completed my PhD from Kennedy Western University. And I've worked at Moore Regional Hospital, or what used to be Moore Memorial Hospital at my time there many years ago. And I've been with Richmond County government as the local health director since 1991.
All right. So speaking of being the health director, earlier this year you were honored as Health Director of the Year by the North Carolina Association of Local Health Directors. So of course, congratulations on that. But what did that award personally mean to you?
It meant a great deal to me. It certainly was unexpected. I was co-chair of the selection committee actually, and we had selected, or so I thought, we had selected another person for that award this year. And so on the day of the award, I was very surprised when things were switched up and my name was actually called, and I saw some of my family as well as some of my staff come in that day. So I was very humbled by it and very appreciative of it.
So as health director here in Richmond County, talk to us a minute about what your role is there and the health department in general here in Richmond County.
Well, as you may or may not know, we are first of all, a consolidated county. So in Richmond County, the health department, the social services department, and the aging services department are actually a consolidated health and human service agency. So we are kind of one in three, but at the same time, each department has its own identity, and the public can come to the health department and receive services from the health department that you would traditionally receive in any health department throughout North Carolina. Every county has a health department. There are traditional services that all health departments provide, but at the same time, every health department also provides other services or provides services that maybe not every health department across the state may provide. As an example, in Richmond County, we do have a dental clinic that's not provided in every county. We also have a primary care clinic that's not provided in every county. And we have a pharmacy assistance program to help those individuals unable to purchase prescription drugs. All of those programs have been very successful and continue to help literally thousands of people in Richmond County with needed services. Of course, for the last 8 or 9 weeks, it seems like our whole world has been turned upside down, and everyone's focus at this point has been COVID-19. So we have focused all of our attention now on communicable disease and COVID-19 for the last several weeks.
Okay, I'm glad you brought that up, because let's talk about COVID-19. So it's been several weeks now, actually, since this whole pandemic has been going on. Of course, it's got the state, the county, the city, the country, the world kind of on lockdown. But when all of this first started to get out about this pandemic, this virus, what were your thoughts about it?
Well, my first recollection was when hearing about it in China, in Wuhan, China. And then as you begin to hear about it spreading across China, obviously I was trying to stay on top of it, and the state of North Carolina Division of Public Health did a great job of trying to keep all of the health departments across the state very informed as to what was going on as this disease began to spread to other countries across the world. And as it came into the United States, we were obviously learning a little more about the disease, and then as it even began to spread into North Carolina, we were even become more acutely conscientious of what was going on. As it came to North Carolina, as you may know, we were actually the 90th county to get it. So we went for a great period of time, and we had no cases identified in Richmond County. We were doing testing like other counties were doing. We just weren't identifying people who were positive. And so we've only had it for 9 weeks now in Richmond County. So it's been a short time.
Yeah.
Or, not 9 weeks, excuse me, 21 days. I've been dealing with this about 9 weeks, but it's only been 21 days that we've been dealing with COVID-19 in Richmond County since our first positive case. So a lot's happened in the last 21 days since our first case, but we've been really following closely with this since the first of the year when things started really ramping up across the world.
Now, you mentioned how we were seems like one of the last counties to have a positive case, and I wanted to piggyback off of that because I know it seems like it was a lot longer than just 21 days ago.
It does.
But of course, there in the beginning, a lot of folks were watching that map to see, when their county would have a positive case, and it seemed like there for a while we were holding out, and all of a sudden we were the only county there in this entire area, North and South Carolina, that hadn't had a case. Why do you think we were able to hold out so long? Was it because of testing? Was it the fact that just no one here has it? Could that be the case?
Well, we were doing the testing just like other counties. We were trying to keep up with the proportion of our population that we were testing in comparison to other counties, and we were testing as many people in our county that other counties were testing in our region. We just were not identifying people. I honestly believe that much of it had to do with the location of our county. We were not near an airport. We were not near a major highway like some of the other places. And I think it just took it some time to just spread to Richmond County, to be honest. I think that was really the primary factor as to why it took a little time to get here. We were doing testing at the drive-through clinics. The emergency room was doing testing. We were doing testing at the health department. Convenient care was doing testing. Some of the physician offices were doing testing, but it just took some time for that first case to appear. But once the first case appeared, then it just began to spread in our community, as it has continued to do even today.
So speaking of the testing itself, you mentioned drive-through testing. Talk to us about what actually goes into the testing of COVID-19.
Okay. With the testing, at this time, of course, all the testing that's being done basically anywhere in North Carolina does require a person to have symptoms in order to be tested. The three primary symptoms that we have been looking for have been fever, cough, and shortness of breath. If someone had a fever, and the number we were looking for in a fever was 100.4, and then cough and shortness of breath. And those were the three we're looking for, and then with that, we could do a COVID-19 test. Over the last week or so, the CDC has expanded the symptoms that they're also looking at. They're looking at other symptoms now, such as chills, headaches, loss of appetite, loss of sense of smell. So there's about nine symptoms now that they're actually looking at. But if a person has any of those symptoms, then they would qualify for a test. And again, we're trying to encourage everyone to come to the drive-in clinics or drive-through clinics. They're held on Tuesday and Thursday at First Health Richmond Memorial Hospital. If those days are not convenient, we are also partnering with Moore County. They have a drive-through clinic on Monday, Wednesday, and Friday in West End. And we have had several of our citizens to go there on Monday, Wednesday, and Friday. And likewise, they've had citizens to come here on Tuesday and Thursday. And that is from 9 to 1. That time doesn't work for everyone. So some people have gone to convenient care. Some that have become very sick may have gone to the emergency room and been tested there. We have done some testing at the health department at other times. Some physician offices have done testing. So we try to make it available when we need to, but we're encouraging anyone who can to go through the drive-through clinic, because we do have there is a dedicated staff with First Health, and we do send some health department nurses to assist them, that we can make that process fairly seamless and no one has to even get out of their car. They literally just drive through and everything is done while they're sitting in their car. And it makes it much more convenient for them if that time will work for them.
Okay. So during this epidemic, it seems like it's been very easy to have rumors going around, especially with social media. A lot of people have been looking to yourself and your department during this epidemic. How do you guys go about quelling some of those rumors that get out there when something like this happens?
We had, up until until Monday of this week, we had tried to issue a press release each day to try to give out basic information in terms of how many people were being tested, how many positive results we were receiving, how many negative results we were receiving, information about where to go to be tested. We began about a week and a half ago, maybe 2 weeks, breaking down the areas of the county that individuals who were positive lived in. We were doing that by zip code. We can't get much more finite than that without breaking someone's confidentiality, but we can identify at least the township that individuals live in. All for the last week, or about the last 2 weeks, we've been working on developing a dashboard, and so on Monday of this week, we did launch a dashboard, and so we have stopped doing the daily press releases, and now we're trying to direct everyone to go to our dashboard, and we're trying to put all of the same information on the dashboard, and anyone can look at any time that's convenient for them. We try to update it each day at 2 o'clock so that we can have the same information we were putting in the press release on the dashboard each day. There are other rumors that pop up, social media. There are a lot of great things about social media, but at the same time, sometimes people get carried away on social media and do a lot of other, go in a lot of different directions. And as we see different comments on social media, we try to address that through our own health department Facebook. So we post throughout every day on Facebook, and we're trying to address some of the concerns on Facebook through different messages that we're trying to send out to individuals.
Can you give us what the current numbers are for Richmond County now?
We can. As of 2 o'clock today, Richmond County has 47 active or confirmed cases of COVID-19. We have 4 individuals who are in the hospital, 27 who are being cared for at home, who are on home isolation. We do have 14 individuals who we are considered recovered now, and they're no longer considered being positive for COVID-19. We do have others that have been tested. We don't have the results back. The results are coming back now in 24 to 48 hours. That's one rumor that we've had a difficult time trying to overcome. Initially, it was taking sometimes up to 12 and 13 days to get results back. Now results are coming back usually in no more than 48 hours, sometimes in 24 hours. all the results are coming back. But we do have 14 that have recovered, and every day or two we'll have a few more that are going to be recovering. But we have to keep in mind this has only been going on for 21 days, and it can take up to about 14 days for most people to be considered recovered. So with 21 days, we can't expect many more than 14 to have recovered, because we didn't have that many 14 days ago to have it. So that number will continue to increase, while the number of positives are probably going to continue to increase for a little while as well.
Okay. So what ways can people continue, obviously, to help prevent contracting this respiratory disease?
A couple of items that we're still trying to heavily promote. Obviously, one is to strongly practice social distancing. I think everyone has heard this message, but we are still trying to promote it. I think our population has done a good job, but we still have members of our county who probably don't do as well as they could. We need to practice keeping that 6 foot distancing between ourselves. We need to practice keeping the number of individuals at 10 or below in groups to keep our groups low. People that are 65 and older, it's really important for those individuals to try to stay in their homes as much as possible and only leave their house if they have to leave. Those other high-risk groups, it's important for those individuals also to do everything they can to protect themselves and limit themselves from being out to exposure. Some of those high-risk groups are people with heart disease, people that are asthmatic, people that have compromised immune systems, people that are very overweight, and that would be a BMI of over 40, people that have lung disease. It's important to try to take extra precaution to protect ourselves. Wash hands very frequently throughout the day. If soap and water is not available, and that's the best thing to clean our hands with, if that's not available, try to use hand sanitizer best we can. Use face masks when we're out in public if that's possible to utilize. We all, I know, probably have to go to the grocery store and to go to certain places to take care of some of our business, but if we can try to limit when we have to go and the amount of time we spend in the store when we go, so we can get in and take care of what we need to do and then leave, and maybe try to limit the number of trips we have to make, at least during this time when we have so much exposure going on. I think that could greatly help all of us a whole lot. And hopefully a lot of these restrictions will be lifted soon and we can get back to our normalcy soon. But the more we try to keep this down, the sooner we can get back to some type of normal life for all of us.
Yeah. And I want to follow that up with kind of an open-ended question, but where do we go from here? What's the future look like immediate future?
When we say immediate, I think it probably depends on how we define immediate. In terms of the next couple of weeks, my strong suggestion, is that we continue doing what we've been encouraged to do for the last month or so, and that is to practice social distancing, to continue washing our hands as frequently as we can, to try not to touch our face, use facial masks if it's possible when we're out, to stay away from places that we just don't need to be unless there's a need for us to be there. Don't gather in large groups, keep our group settings as small as we can. If we know of someone that's sick, certainly try to stay away from them, but at the same time, try to help people. If we have elderly people in our family or friends or neighborhood, try to do things to help them so that they don't have to get out. If we can go do their grocery shopping for them, or if we can run an errand for them, go get their prescription medicines for them so that they don't have to get out, I think that can help a great deal. I realize as much as anyone, our economy can't continue to be in this shutdown mode. We've got to get the economy back up and running. I think we all realize that, or we're going to collapse. But we've got to, we can't start the economy back up and then everything spread again very quickly and then have to close it back down. I think that could be more detrimental than trying to open it up too quickly. But we can open it up sooner if we can just all try to slow down the spread as much as we can right now so we can open it up safely for all of us.
So let's end with this, Dr. Jarrel. What are some of the good things that you've seen happen or come out of this pandemic?
Some of the good, I have seen several good things. I think I've seen a lot of good come out in so many people, helping people, giving to other people, looking out for other people. I've seen so much of that. But I've seen people give out of their pocket. I've seen businesses give to people. I've seen the community give to people. I think there's more compassion with so many people now. Some compassion being shown that maybe wasn't there in the past. I've seen our religious community seem to be really out in the community more maybe than it's been in the past. So I think all of that's been good. And at homes, hopefully it's helping families get a little closer to each other because we're spending time with each other whether we wanted to or not. But I think that's been good for us to just slow down a little bit and be with each other and maybe reset our priorities a little bit about what's important.
All right. Dr. Tommy Jarrel, Director of the Richmond County Health Department, roughly 6 feet away from me. We really appreciate you joining us for our County Conversations. And of course, want to give another shout out to our sponsors for County Conversations. Those are One Stop Vape Shop, McNair Auto, Rockingham Paint and Glass, The Berry Patch, Sunbelt Distribution, Kenny Melvin at Farm Bureau, Computer Zone, Remax Realty, and Iron Horse Auction Company. Once again, Dr. Jarrel from the Health Department for joining us. I'm your host, Matt Harrelson. Have a good night.